Good morning, Facebook fans and family. We're just coming to you live this morning, starting our day off early with a little bit of ideas and suggestions for you for the shoulder issues that we see in the office. As we take a look here on this poster, something we commonly refer to as different type of shoulder injuries, and that can vary from an impingement type syndromes, from trauma, from repetitive use, even from posture, those people that get to sit at the desk all day long. Also, more patients are susceptible as they age to have some type of different shoulder injuries. Definitely a reason for having a shoulder injury is falling out onto an outstretched hand as well, and that just creates a lot of trouble into the shoulder. So today what we do is we'll go through a thorough exam. Obviously history is always important. What caused the injury? What's the repetitive things that you get to do? Do you sleep on it wrong? Coming back to posture. Do I sit all day long as well? Ideally, we'd love to have the patient be in a neutral position. Nobody comes in that way because of what we get to do all day long, or also because of the different activities, throwing activities, and so on. So what we find is the shoulder comes forward. That puts a lot of tension and stress into that shoulder. And so doing the appropriate stretches and doing the appropriate rehab is always important as well. I'm going to show you a couple of stretches that we do, that we recommend for our patients to go through. One of them is just pretty simple. It's taking a broomstick after you get done sweeping the floor, or get a PVC pipe or some type of pipe. You're just going to hang on to it, try to keep the arms straight. The idea is to be able to go all the way back through and then touch the back and then come back through that way. Not very many patients can do that, but I would just have you do 10 reps of that. Then we're going to go into a different stretch. This one is a bandage stretch, and so we're basically going to put this arm, the shoulder, into a neutral position as we stretch a lot of these muscles. Again, we talked about that everybody has more of an internal rotation is what it's called, or their shoulders are rolled forward, so we want to stretch the opposite direction. I'm going to have you hang on to a band that's attached high up into a door frame or on a squat rack rig. You're going to turn, make sure that palm is turned up. You're going to go back into a reverse lunge. I'm going to set back with it. Let it distract my shoulder or pull my shoulder. You're going to set back with it, let it distract or pull the shoulder. Now obviously we want to make sure that you don't have a shoulder injury before you were to do something like this, but that's a great stretch to help stretch a lot of the structures inside the shoulder, the ligaments and tendons and muscles with that. Some other things that we do, some treatments that we do, obviously we're big on mobility and movement. This is called the pain device here, torture device, but this will lay down onto. I'm going to go over that one real quick. I'm going to start right up here in the upper back area. You're going to roll to each segment. You do not want to be on the spine, but I'm just going to go back and forth and get some movement, some mobility into that mid back. I can bring my arms back as well to help out with that. I'm going to go down to the bottom of the rib cage. You can buy these fancy things at Walmart. We usually suggest that patients will make one with two tennis balls. We're going to tape them together, turn it, tape them together, and tape them in the middle. And again, you do not want to be on the vertebra, on the spinous processes when you do that. Some other treatments that we're doing as well is we're doing compression therapy for some of our overhead throwers, javelin throwers, baseball throwers, softball. And even those that just have some tightness in the shoulders. This has been swimmers as well. This has been a pretty good treatment for. Basically, it just helps to push new blood down into the extremities, push the old blood out, and it just helps with soreness and so on. That's called compression therapy. We also, for therapy, we use some different types of the cupping, just some soft tissue work as well. And then also, we do a treatment called functional dry needling. We've had pretty good success with this. Just with a lot of the tension, a lot of the impingement in the shoulder issues patients have had. So if you have any questions, leave a message down below. Call us at 620-504-6344. You guys have a great rest of your 80-degree weather today and enjoy the snow tomorrow.